It is 4 o'clock, and I know that because I can hear the beautiful sounds of the bells in Breslin Tower, and I know you all will learn to enjoy those as well when you come visit campus. My name is Susan Askew, and I'm class of '86 of the college, and I am Associate Vice President for Alumni and Parent Programs. And I'm just so excited to be welcoming all these new students to campus and all these new families. And just can't wait to meet you all. And I hope that you are planning lots of visits to campus. Tonight, or to this afternoon, it's 4 o'clock here. We're in for a treat. We are trying to share some information before you get here on campus so that you can have as much information as you want. And so we've got a Zoom this one today, and then one next week, and then when you're on campus here for orientation, you'll have a chance to hear, get a lot other information as well. But what I wanted you to know is how today is going to work. We're in for a treat. We've got 2 representatives here from our that can cover the information from health and wellness. And we had promised you safety, but we're going to reschedule that for another time. But you will learn about that. We were unable to make that happen tonight, but we're rescheduling it. And it's important for you guys to know, though, just quickly, that our Sewanee police force is full of deputized police men and women. And so they're right on campus. I mean, it's really kind of a unique thing to have that kind of security right here on campus, and safety. And then also, you probably do know this, but we have the Sewanee Volunteer Fire Department right on campus, and is even made up of a lot of students. And that's a privilege for them to become a firefighter and get all the training. It's really a first class operation. And then finally, there's a Sewanee hospital right here on campus too, across from the Sewanee Inn, with an emergency room and other things like physical therapy and just lots of things like that. But we'll learn all about that at another time, but I did want to just touch on that a little bit. But for today, we're going to hear from our 2 guests, and some of you have submitted questions. And so we're going to let them kind of give a little overview and summary of what they can offer students here on campus. And then I will read some of the questions. And then if you have any questions that were not one of those, or you think of during the conversation, do you guys know how to operate the chat down there? If you'll put a question in the chat, or if it's easier, if you just want to email me, because you might have my email handy, I'll be able to check that while we're here. But I think that's it. I'll share some information before we wrap up, but I'm going to turn it over to our special presenters. We have Lee Collins. She is the Executive Director of the Wellness Commons, and she's also Director of what we call CAPS, but it's Counseling and Psychological Services. And she's joined with Brooke Moody, who is a nurse practitioner serving our students here in that facility. And they're going to tell you all the other things that they offer, and then answer your questions later. So Lee, I'm going to turn it over to you. Do you want me to share the screen yet, or?
Yeah, go ahead and share it if that's okay. Great. Thank you. Thank you, Susan.
Sure. Thank you guys for being here.
So hi, as Susan just said, I am the Executive Director of the Wellness Commons, which is Counseling and Psychological Services, also known as CAPS, and University Health Service, which is our health center. And we also have here something called Fitwell, which is a small gym. Now there's another gym on campus that's Fowler, and we'll talk more about both of those in just a few minutes. So here's the Wellness Commons, as you can see. I also want to just add before we start talking about our slides that I'm also a Sewanee mom. So I really understand the experience of sending your kids off to Sewanee. And so if you have any questions that relate to health and wellness, or you have any questions related to being a Sewanee parent, feel free to reach out to me and we'll have our contact information in the very last slide. So as I said, this is the Wellness Commons. So it is, yeah, you can go ahead. Next slide. So as I said before, it's made up of UHS, which is how your students will refer to it, and CAPS, which is Counseling and Psychological Service. And you probably won't know what that means when your students tell you, unless you keep this slideshow. Fitwell, which is designed to be kind of an inclusive workout experience. And the Wellness Commons believes in a holistic approach to wellness. So we've partnered with some other entities on campus and brought them into our building, which is just a couple of years old. We have Sewanee Outdoor Program, also called SOP. Your students won't call it anything else, so get used to that. And that is a program that takes students on hikes and also on extended trips, camping, kayaking, bouldering, climbing. It's for the adventurous students on campus. And the trips that they go on are both on campus because, as you all know, we live on a beautiful campus that has climbing opportunities and has lakes and has a 20-mile perimeter trail right here on campus, but also takes them all over the place to other states and I believe sometimes to other countries. We also have a small bookstore we call the Baby Bookstore here in the Wellness Commons. So if students live right across the way from us and maybe forget a blue book or forget to get water before class, they can pop in here and pick that up as well. So where are we located? We're located right in the heart of campus. A few years back, we were kind of far away, kind of tucked behind the hospital across from the Sewanee Inn. And then in a gesture designed to show that Sewanee is really committed to educating and caring for the whole student, they decided to move us right to the center of campus. We're in a beautiful building on University Avenue, right next to McClurg and the chapel. McClurg, if you don't already know, is the dining hall. And this, so a campus partner that I forgot about also is a lay chaplain. He's often not in his office because he's all over campus meeting with students, but he is right here with us as well. So now I'll give a little bit of an overview of our services. You can see here in these photographs, sometimes we wheel our cycles outside and offer spin classes, which are taught by students. And we have an example of our new director, Mindy Holloway, examining a student, and then one of our counselors working with a student as well. Those are all students just posing for this. There are no actual real clients seeing us at that time because that would be a HIPAA violation. So UHS is the primary care center on campus. They provide a surprising amount of services, and I'm just going to turn this slide over to Brooke to talk for a few minutes.
Sorry, I didn't realize I was muted. We are a full-service family practice clinic. We evaluate and treat all different kinds of illnesses, injuries. We do well exams. We gynecological exams. We do a lot of health education. A lot of our students travel abroad, either for full semesters, or they'll take travel abroad opportunities during breaks, such as summer break, Christmas break, things like that. And we do all of their physicals here. We do evaluate their immunizations. We keep a lot of those immunizations on campus, but if we are not able to keep them all, because that is a lot. But we do have the Franklin County Health Department that has a travel clinic that we partner with to make sure that the students get all of that done before their study abroad. And then if it's something that we can't manage here on campus, we do referrals out to specialists.
Do you want to say just a little bit about psychiatric medication?
Oh, yeah. So up until this point, we had partnered with a psychiatrist and we're offering telehealth. But starting in the fall, I will be transitioning into a role. I am a family nurse practitioner, but I've done extensive continuing education in psychiatric medication management. And so my primary role in the fall will be to manage students' anxiety medicines, depression medicines, ADHD medicines, things like that.
So Counseling and Psychological Service is a fully staffed counseling center on campus. Typically what we provide is brief treatment. We don't have session limits like a lot of schools do, but most students find that they can have their psychiatric or mental health needs taken care of in about 5 or 6 sessions. For people who need ongoing counseling, that's no problem. We can provide that here. If they need more intensive than we provide, because usually we do meet with the students bi-weekly, we have several therapists living in the area, and we provide referrals and do some case management to get those to those students. We also, to those therapists, we also provide referrals for psychiatric evaluation and medication. We typically find that most of our psychiatric medication needs can be met in-house. They may need to go outside of Sewanee for medication, but they can typically get the prescriptions written here. Okay, I think that's all that I have to say about that one.
This might be a good time. One of the questions that came through was, where do students get their prescriptions filled? Is there somewhere on campus, or do they have to figure that out?
We have a very well-stocked dispensary in UHS. We keep most basic medications like antibiotics, steroids, inhalers, some antidepressant, anti-anxiety medication, birth control, anything that would be a common occurrence among people in this age group that we typically see. Rarely we will have to send prescriptions out. CVS in Mont Eagle is very convenient, but then I did see also somebody had asked about a delivery, and there is one pharmacy called Bennett's. I think it's in Winchester, and they do offer periodic delivery. I think they'll do it once or twice a week. So if it's something pressing like an antibiotic that they need to get filled quickly, then they usually will go down to CVS in Mont Eagle or get it from our dispensary. But if it's an ongoing medicine that they're getting refilled, Bennett's will bring that up here.
And Bennett's is a wonderful pharmacy in Winchester, which is about 25 minutes away. And often students go there if they want to. There's a great coffee shop there, so students are going every weekend to the coffee shop. One issue that's sort of that arose during COVID and hasn't yet been kind of worked out is we don't have a really reliable transportation system to these small towns near us for students who don't have cars. So we always, in the health center and in CAPS, we always encourage students to come to us if they have any kind of transportation problems. If they need medication or any kind of medical or psychiatric needs, we want to know about it. And we do have a system in place where we can arrange transportation for them, but they just have to know to speak up, because we don't have shuttles that are running regularly back and forth to Mont Eagle and Winchester. I will say though that that almost never happens, that people ask us, because so many of the students here have cars it just is really easy to get a ride. People are almost always going to the pharmacy in Mont Eagle. Is that, Susan, you've been here longer than we have. Would you agree with that?
Yes, and even if they haven't found their buddies yet that might do that for them, I have found that the staff in the residence halls will help, or
there's always a way.
There's always a way, and it's good that they can come to you all too.
If you haven't already signed up for some of the parent chat groups, I'm saying this as a parent. The unofficial Sewanee parents page on Facebook is also really great for this. I don't think I've ever seen anyone put out a request for assistance that didn't get an immediate answer. So sometimes it's, someone your kid doesn't even know who's going to pick up your kid because their parent read something on the Sewanee Facebook page, which I know Susan has been a big part of kind of keeping going. So definitely sign up for that. But also feel free to call us if you have a concern and maybe your student is hesitant to reach out to us, because we don't want transportation to be an obstacle for any of our students. And it really typically isn't, but we don't want anybody at all to fall through the cracks. So Fitwell is the gem in the Wellness Commons, and we made the decision to put a gem in the Wellness Commons because of our holistic approach to wellness. For instance, I'm a therapist. I'm the director of CAPS in addition to being the director of the Wellness Commons. And I know that exercise is often as effective as antidepressants for anxiety and depression. So regular exercise is really important to your emotional well-being. And I'm sure Brooke could make a speech about how important it is for your physical well-being. So we wanted a gym that was inclusive of all body types and all fitness levels. And so that place is Fitwell. The Fowler also is, but a lot of our athletes work out at Fowler, even though it's not a designated gym for athletics. So Fitwell is a very small, cozy place. We have, as you can see, a yoga studio, and we have a spin room, and students typically teach the classes, which are very inclusive and fun. Last year, they had a Taylor Swift night, which I think was our well, I want to say it was our most popular night, but it had the longest waiting list. Our spin classes are typically very full, and so are our yoga classes, and we keep adding more and more. And there's also a small workout room. One side of it is for aerobic exercise, and one side is for strength building. And we have a new director, JJ Geralaman, and he has an extensive history in fitness. And so he is beginning this fall to give free fitness assessments. He has specialized equipment for that to really help students figure out what their fitness level is and how they can just gradually increase it in a way that's not, scary and intimidating for them. So as I said, we offer spin classes, we offer yoga classes, we offer circuit training. Many of those are taught by students or by our staff. So as I said at the beginning, wellness is multifaceted. There are many things involved in keeping a student emotionally and physically healthy and happy on campus. And so if you want more information about the Sewanee Outdoor Program, we have a link for that here. You can go to our website. I'm happy to send these slides to anyone who wants them. I just realized that did we email them out ahead of time? Okay, we're happy to send them. We have a great lay chaplain. We also have a great chaplain who's in charge of our whole program, Peter Gray. And then we have our mini bookstore here. And here is our contact information. The top number is our general number that you can call with all questions or concerns about wellness at Sewanee. I also want to take this opportunity to mention that we have a 24/7 mental health crisis line. This is for students. It's a company that contracts with, I would say, the majority of universities in the United States, but this is actually a Sewanee specific number, and they have links and communication with me, with our police force, with our fire department. So if they need any assistance on campus, they call immediately. If as a parent, you're concerned at all about the safety of your student, this line is designed for students, but parents have called in the past, and it is totally fine to express your concerns at this number, which is, like I said, open 24 hours a day, 7 days a week. And this is our contact information. If you have specific health questions, the first email address, uwc@sewanee.edu, is the best place to write. Or if you have questions about counseling or psychological services, caps@sewanee.edu is the best way to reach us. And also, we're both parents of college students, Brooke and I are, and we really love to talk to parents. So you are definitely welcome to call us or email us with any questions or concerns you might have. And now I guess we'll open it up to questions.
Thank you guys for that great overview. And it is nice to know how many things are offered. And one of the questions was how much can parents contact you and get information? So that's good to know that you're willing. And is there a way, like I know you're going to add to that. Please do.
You are welcome to call and share information, and you are welcome to call and get information about what services we offer. One hard thing, and I remember it well, when my daughter went off to college, she turned 18 right before she left. And at that point, she was an adult, and I got kicked out of her medical records. And the fact is, our students are protected by HIPAA. And so we cannot give information about your child, even to you, without their consent. But it is very common. I know, Brooke, you can talk about this, where a student is sitting in a nurse practitioner's office, and the nurse practitioner is trying to get a little bit of health history, and they say, I don't know, can you call my mom or dad? And we do get a release of information, and we are totally happy to do that. Brooke, what do you have to add to that? Because I know you do that all the time.
Yes. So there's two different things that we can do. Like, it is not uncommon at all, like Lee was saying, for a student to call or FaceTime a parent while they're in the exam room. Just maybe they're not understanding what I'm trying to explain to them about a medication, or they're stressed because they've been diagnosed with mono and they don't know what they're going to do about their classes, and they want their parent to be in on the planning of their care. In those cases, we just talk like you're in the room. But then if it's a matter of transferring information over the phone with the student not present, then we will have a release of information signed. We do have to have a release of information for every single visit. There's not a blanket consent that they can sign. It would be every single time they wanted you to have information about a visit, they would sign that release, and then we would be allowed to talk to you about it.
And that actually is a little bit different for counseling. We will kind of figure out what our students are willing to share and make sure we're clear on that. And then our consent will cover, the student selects how long. It can be every visit, it can be a year, it can be another time that they designate. Most often, students, once they know we're talking to you and they want us to talk to you, they are perfectly happy with us talking to you. So typically they check a box that says, until I am no longer a student at Sewanee. So we can have multiple conversations. And I will say that there are, of course, exceptions to our confidentiality policy. If there's any reason why we think your child might be in potentially life-threatening harm, confidentiality is changes at that point, and we will call you if we feel like we need to. Typically, if we have to hospitalize someone, we almost always are in a conversation with the parents when that happens. It'd be very, very rare for that not to happen.
That question I saw also came up on the parent questions about athletic emergencies or other physical medical emergencies. We do, like the slide said, we have a hospital on campus. There's an ambulance, they can be transported to the emergency room. And at that point in time, it does become emergent, and the parents are contacted to just know what's going on with their student, because it is at that point changes from just a basic medical visit to an actual emergency.
And I did not see this question asked, but is there, I feel weird asking it, but is all this provided, or will they get a bill? Because I've just had, my son just turned 18 and I'm struggling. He just had ACL surgery and I can't even pay the bill because I can't log into his portal. I mean, I
Oh
can,
my
but
gosh. Yes, that is a very good question. And I'm so glad that you asked it. I'm going to start with the easy answer from counseling and psychological service, and then I'm going to turn it over to Brooke because her answer is going to be a little more complicated. For counseling at Sewanee, counseling services are free. So I strongly recommend that if you think your student needs to work on some life skills or work on some distress tolerance or work on some anxiety management, you just encourage them to get counseling. We also offer what's called a DBT group, dialectical behavioral therapy group, every semester. And I'm from New Orleans, and when I referred people to DBT groups, it was very, very costly. And in my opinion, I think every person of this age, it's a very difficult life stage, emerging adulthood. Everyone could use it's a very skills-based class, DBT. It teaches distress tolerance and learning how to manage strong emotions. Everybody should do it, and we offer it for free at Sewanee. So now the more complicated answer.
So on the UHS side, we do take all different kinds of insurance. Most of our students have insurance. For those that do not, we do offer self-pay pricing, which is a discounted rate. I don't hold me 100% to this number, but I think it's at a 40% discount from the standard fee. But yes, we do charge insurance and or the student for our services. The dispensary items, the medications, they range anywhere between $5 and $20. So even if they get their medications filled here on campus, we try to keep those prices very, very reasonable.
Please encourage your students, if they have concerns, to talk to their provider about them, because sometimes our students don't know the options, or they might be nervous about saying something. And these are conversations that we are perfectly equipped and happy to have, because we don't want any student not getting treated if they need it. We can work with them.
great. Thank you for that. Somebody's asking about dental care, and especially if there's an emergency.
There is a dentist here on campus, Dr. Matthews, down by the hospital. We've referred multiple times to their office. A lot of times, if it is, like an infected tooth, we'll start them on antibiotics here in the wellness center, and then set them up for a visit with the dentist within a day or two. But if it's like a fractured tooth or something like that, they are usually really good about getting them in same day.
And I will say, I've never known anyone to love their dentist the way our students love this dentist. I haven't met him, but he's very popular.
Yes, he's my dentist. And in fact, when you said he's on campus, it is like right by the hospital, but it's a private practice. It's not run by the university. And it's kind of first class, state of the art equipment and all that. Okay, so there's still a lot of questions about the forms and the access to records, and somebody has maybe a power of attorney, and should they use that, a healthcare power of attorney, or just follow the process you had mentioned, that you fill out the form as they arrive?
Mm-hmm.
So because they are adults, the healthcare power of attorney, I know a lot, we run into this a lot. And again, as a mom of a college student, I understand how hard it is, but no, they do have to sign that release of information with every visit for us to be able to talk to you. So if you want us to have it on file, we're happy to have it on file, but they still have to sign a release every time we talk to you.
Okay. Yeah, lots of those kinds of questions.
So specifically about the forms, we know that there was some anxiety about the deadlines for forms, and there was a form that apparently has been around for 10 years, and we didn't realize that it said that your student would be unenrolled. That is not true. So we're correcting that language. No student's going to be unenrolled. If you have questions about the forms, you can type specific questions here, but also you can call our office and we're happy to answer them. But I want to remove that anxiety. You work towards getting them in, and when you get them in, we're going to take them.
Well, and
I
along
asked
those,
about here about the release online, or do we give it to them at the exam? Most of our students, I mean, if they're coming in for strep throat, we usually do not have them sign a release of information for that unless the student specifically asks us to speak with the parents. We are not usually going to try to get a release for every single visit unless it's at the student's request.
And if you wanted to call us and share a concern about your student, or you wanted to email it, we typically like to have our release of information form, which we have in-house. So the student would come in and sign it. You also can tell us information. We just can't give you information. So if you needed to share something with us, we won't even tell you typically that we're following up, but if you share some information with us, we will follow up.
well, and sort of along those lines, you've talked about all the things you offered, and the student needs to kind of be proactive and come see you guys. Are there any programs you do where for people who are reluctant to come by to see you?
So from the counseling side of things, we do a lot of outreach. We met with our vice chancellor today, and he said, who in here does outreach? And everybody raised their hand. We all do programming. We all partner with theme houses. Some of you parents may not know a lot about the theme houses, but they're wonderful. There are houses that students live in on campus, or their residence halls that have a hall that is devoted to a particular theme of students with shared interest, and they host activities almost just about every weekend. Most of the theme houses do something. One thing that I, as a parent, really like about them is all of the theme house events are substance free. So people will be drinking at fraternity parties, but these are all substance free. So your students have other choices on campus. This past year, we partnered with theme houses and we provided a CAPS liaison to every theme house. And so they've done a lot of programming with us. For instance, we did a self-care Saturday. We have one that's ongoing with a house called Community Engagement. That's called Brain Hacks. And the counselor just goes and they eat food and they talk about stress management skills, and they talk about the brain and anxiety and things like that. And it's very popular and well attended. The craft house does crafts every weekend. And so we're looking at how to build a kind of a therapeutic component to that. We also go to the Greek houses and other organizations and do suicide prevention training and stress management trainings. We train the proctors on those subjects as well. So they have this body of knowledge and they're living in all the residence halls, prepared to help students with that. We're pretty much out and about on campus all the time. We also have a program that's called Let's Talk, which is a program that's done at many different universities throughout the United States. And it's designed to get the counselor out of our offices and into spaces that might feel a little more accessible to students. So sometimes we have drop-in hours outside or in dorm rooms or things like that. And we have a great therapist named Molly who's in charge of our Let's Talk program going into the future. So that's counseling. How about on the health side of things?
Well, we offer several classes in the Wellness Center, but we've also gone out on campus and done classes on methods of contraception, STI education. We've done, we have the peer health educators, which I'm going to be taking over this fall. But that's a group of students that are interested in helping get different health information out on campus. Generally speaking, they choose the programming that they feel is most appropriate to the campus, like what they feel their peers need to hear from them. And then I will work with them on developing programming for them to take out on campus to then educate their peers.
And we also work closely with Peer Health on the counseling side of things as well. The self-care Saturday I talked about, it was actually run by students. I did about 4 or 5 training sessions with peer health students, and I was there with them and I was helping them. But by the time we hosted the event, which was very well attended, the peer health students were ready to actually teach it themselves and did a phenomenal job. So we're kind of all over the place on campus.
In my experience, it does seem like us helping the peer health educators with the programming, the students respond better to other students than a lot of times than they do to, you know, adults coming into their space and trying to preach at them. It feels more collaborative when it's their peers and not so lecture-y like it would if it comes from one of us.
Great, thanks. I've seen a handful of questions about athletic varsity sports and those kinds of injuries. That's a different angle, right?
I'm not really sure how athletics handles that. I know if they come in here with just something mild, a sprain or something like that, yes, we do charge that like a normal office visit. But I know that the trainers and the coaches have a whole protocol that they follow that's separate from us.
There's also still several questions about prescriptions, and I guess maybe the clarity, when do they send it to CVS or Bennett's versus you guys? A prescription that they've already got like on regular basis.
So in that case, the student will have the choice. Like if their primary care doctor at home is comfortable continuing to write that medication and they want to do that, they want to do a mail order, they can have it sent to the Sewanee post office. There's nothing that says they have to get their refills from us or that they have to transfer their care. But we are also happy to do that for them. And a lot of times I feel like the students like the convenience of being able to come to us and get the prescription instead of trying to work out telehealth with a home provider or things like that.
So typically when they come to us, it's a matter of whether we have it in-house or not. So if we don't have it, we're going to let the student know, and then they're going to, and we'll send the prescription to one of the other pharmacies. But yeah, Brooke is correct. Many students just have their doctors from home send the medication directly to them in the mail, or the parents go pick it up and mail it to them.
And I don't know if you said this or not, but someone's asking, do y'all have EpiPens?
We do. We keep EpiPens in, and we make sure we have several in stock at a time. We don't have them in our dispensary to provide to students. We usually send those prescriptions to the pharmacy, but we do have them in case somebody comes in with an allergic reaction. We have plenty of EpiPens handy to take care of the students.
Right.
And I am pretty certain, Chip's not here today, so he can't comment, but I'm pretty certain that the fire department and the police department also have EpiPens.
Right. I know we keep talking about the hospital, and but there's a few questions. How close is it? Is there an emergency room? And you guys, it is right on campus. If you know where the Sewanee Inn is, it's exactly across the street from them. Backs up to a couple dorms, Tresvan and Courts. I mean, it's just right there. And they do have a emergency room with, y'all probably know better, but stocked with doctors from Vanderbilt and Nashville that man our emergency room care.
We often, not often, it doesn't happen that often, but when we take students to the hospital, we walk them down the street, and it's an easy walk down the street.
Mm-hmm. Now, if they needed, like, if it's an appendicitis or something, they wouldn't do the surgery.
We call 911
in Sewanee, but they have a heliport. So I mean, if they needed to go somewhere other than there, they can get them there.
Mm-hmm.
More prescriptions. How available is Narcan on campus?
It's widely available. We hope that none of our students ever need it, but if they do, we have Narcan. Student organizations have Narcan, Peer Health have Narcan, the fire department and the police department have Narcan. And we also have a Good Samaritan policy on campus, which means that if your student, let's just hypothetically say that your student is at a fraternity party and he or she is drinking and is worried about a friend who they think might need Narcan, but they want to call for help, your student would never have disciplinary consequences if they picked up the phone and called for help, because the Good Samaritan policy protects them from that.
Okay. You know, we're in a town without Uber or Lyft or anything like that. Someone's asking about a student who might have been drinking, and how do they get places?
Mm-hmm. So yeah, we don't have Lyft or Uber, right? The good thing about the campus is everything is walkable on campus. You know, if you're here and you're walking around, it might seem far, but most of our students, in my experience and from what I know anecdotally, if they're out at night going to parties, they're usually walking with their friends to and from parties. And I will say our students are really good about sticking together as a group and going around with each other. I know as a mom, that was something I was worried about when I came here. If there were any kind of emergency or anything like that, they should call 911 or 1111, which is campus police.
Yeah, and somebody mentions a shuttle service that our office provides on family weekend, but that's mainly because parents are staying all over the place, and we wanted to provide that for you guys to not have to worry about parking or not worried about having a glass of wine, or so we do that on family weekend, but that's just our office providing that.
Right. Sororities and fraternities usually have sober drivers. So people sign up to not drink for those nights, and they will transport people who need to go around in car. Like if your student had a residence hall that was far away, they might want to do that. And on those nights, they all have the number of the students who are driving. There are also sober monitors at all the parties, at all the fraternities and sorority parties. So people they're watching to make sure nothing, these are students, not faculty or staff, but they're to make sure that everybody's safe.
Right. I'm checking email. What are the hours that y'all are open, and what happens if they need care outside of those hours?
So we're open 8 to 4:30, Monday through Friday. And if they need help outside of those hours for the counseling side of things, they will call our 24/7 mental health line, which a lot of students call that for reasons other than crises, if they just really need someone to talk to. But it doesn't have to be, a life-threatening emergency. And if there were a life-threatening emergency, the 24-hour hotline would call me. And if for some reason they couldn't reach me, they would call my associate director. Brooke, you want to talk about medical emergencies?
So generally the medical emergencies will go one of two ways. We usually refer them either to a urgent care. There's one in Winchester. And then of course the Sewanee Hospital is on campus for the true medical emergencies.
Great. And can you just tell us what your staff looks like? How many people, if they need an appointment, is it going to be hard to get one scheduled?
Oh, I'm so glad you asked that question, because we're so proud of this. In the past, because of the way just things were structured around here, there were very long waiting lists. And there's this thing about Sewanee that the students hear a rumor and they think it's absolutely true. And so some students this past year have been telling me that we have 6 to 9 month waiting list to get counseling. We're very proud that for the past year, we have not had a waiting list at all. Even though we've seen a lot of students, we stay busy, but we're adequately staffed. We have, let's see, 1, 2, 3, 4, 5, 6 full-time therapists. Well, actually 2 of us are part administration and we do therapy some of the time, but the rest are full-time clinicians, and we offer groups, and we don't have a wait list. We also have, for counseling, we have same-day appointments every day. So certain people every day have slots that are called same-day slots, and they don't book anything else during those times. And students can walk in, or sometimes they're brought over by case managers who are on something called the care team. So if, for instance, you were worried about your student, maybe he wasn't getting out of bed and going to classes, you could file a care report, which you can find on our website, and they will actually send someone to the residence hall. And if they're worried about the student as well, they'll walk them over to us and they can take one of those same day slots, or often students just walk in and want a same day slot. So that's the counseling side of things. They don't really have a wait in the health side either, and I'll let Brooke talk about that.
Yeah, so currently we have 2 nurse practitioners. We're in the process of working on hiring a 3rd. We have 6 exam rooms. We have 2 nurses. In my experience, I've been here about 18 months. I have not run into a situation where we could not get a student in same day. They can book appointments online. They can call our front desk to schedule an appointment. Generally speaking, if they try to book an appointment online and it's showing that all the appointment slots are full, if they call the front desk, we can usually work them in.
So if your students start telling you that they can't get in for 6 months, please get in touch with us or tell them that it's not true, because so far, I mean, never say never, but that has not been true.
Right. Still just a few questions about prescriptions, and I think, are there any kind of restrictions on how much of their prescription they could have in their dorm room? And is there worry that someone's wondering how to store it and keep it away from other people? Do you have any advice on that? And I think you've mentioned how to start getting the prescription through you guys rather than their primary doctor, but is it restrictions on quantities and how best to store that?
As far as I know, I don't think there's any restrictions on amounts of medication. If their home PCP calls in a 3-month supply, I'm pretty sure they're allowed to have a 3-month supply of their medication.
Yeah, it's pretty
but
standard.
somebody asked about safeguarding the medication, and what I would suggest in that case, really with any medication, but specifically the one that I've seen have problems is like ADHD medication, Adderall, things like that. I would suggest sending your student with a lockbox that they have a key to, or a passcode, so something that only they can get into. I don't think it's a big problem. I mean, I think in 18 months, I've only had 1 or 2 students say their medicine was lost and or stolen, but just to be safe, I would send them with some sort of lockbox.
Yeah, and I have never heard of a story where that happened, but I completely agree with the lockbox. Some of you may know the only thing that gets stolen at Sewanee is bicycles. That's a lot.
Just borrowed.
But err on the side of caution with medication. And what did you say, Susan?
Just borrowed, not stolen.
Borrowed, and sometimes put in the leg. So tell your children to lock up their bikes.
Yes.
Yeah, and I think we covered a little bit of where to buy things that aren't prescribed, just maybe over-the-counter stuff, deodorant, things like that. And the baby bookstore has some of that, and then the one downtown. And then there's the Sewanee Market, which would have a little bit of that. And I think there are programs where the university will take a trip to Walmart, and if people want to go shopping, they can do that if they don't have a car.
Yeah, it's kind of intermittent right now. I'm hoping that they build more back into it. We kind of moved away from that during COVID, and they're just getting back into it. That's especially true during times where there aren't very many students on campus. Like during the winter break, there was a very robust schedule for the students who were on campus to get them to town, to buy whatever they needed, to take them on field trips to Chattanooga and the mall in Murfreesboro and things like that. So during those times, you'll see more of that happening. The most common thing, well, you can get most things just by walking to one of the bookstores or to the Sewanee market, but it's very, very common for students to send out messages and say that they're going to the Piggly Wiggly in Monteagle or the CVS in Monteagle, and who wants to go or who wants to do a grocery order. And the students are pretty, I think it's pretty remarkable. They're pretty phenomenal about getting each other's needs met that way. But when they're not, if something falls through the cracks, please, please, please let us know. Even if it doesn't have to do with health or counseling, all of this has to do with wellness. We don't want any student doing without. I'm sure that all three of us have knocked on students' doors with food or supplies from time to time. This is how this community is. We just all look out for each other.
And then someone's asking about the hospital, and I'm sorry that we have to even clarify this because we've just been talking about it like you guys know, but the hospital that is on our campus is not run by the university. It's part of the Southern Tennessee Medical but it's got its own CEO, and it does have an emergency room. They take people, I think, mostly to Chattanooga if they have to use that heliport,
or Nashville.
So
if it's not a life-threatening emergency, a lot of times, like say somebody brought up appendicitis, they don't do surgery at the Sewanee Hospital. But they do in Winchester. So if it's something like that, where they just need a little more, a little higher acuity care than what can be provided here in Sewanee, a lot of times they'll transfer them to the Winchester Hospital. But for anything, any major emergencies, yeah, my experience is they go to Erlanger and Chattanooga.
And we also work pretty closely with the hospital. So Brooke and I just last week had a meeting with hospital officials. They're very committed to our students and they feel very tied to the university, even though they aren't a part of it. And Brooke and I also went recently to Erlanger, and we also have just direct connections there. They invited us to just pick up a phone and call them anytime, and I've taken them up on that just to ask about availability of beds and things like that. And Winchester, as I said before, for those of you who aren't from this area, that's where most of us do our grocery shopping there. It's not really very far. It takes depending on where you live, between 20 and maybe 30 minutes to get there. And it feels like kind of an extension of Sewanee to me.
Well, great. Well, I think that's everything. If we didn't answer your question, I hope you'll contact us and we'll follow up and get you the information you need. And I want to thank you guys for being here tonight and spending time with our families. And I wanted to remind everybody, next week on Monday, we will talk with people from Residential Life and the dining hall. And you'll learn about more than just the rooms and roommates, but just all the programming they do, and then also how the dining services work on campus. They have several different locations, and how all those plans work and how the meal plan can work with some local restaurants as well. But I hope you'll join us for that. And then finally, I hope you're getting the information about orientation so that if you're dropping your student off early for pre or FYP program or an athletic program, we hope you'll come back for orientation, which is August 19th, and we'll have you'll get to meet our new vice chancellor. He'll come talk to you. We'll have a panel of people sharing other information, and then a little reception hosted by our parents council. So we just cannot wait to meet you guys and we're doing several send-off events across the country, and maybe I'll meet some of you guys there. But Lee,
Can I
did
add
you
one
have
more
something
thing?
else? Mhm.
Yeah, when you said McClurg, I thought of this. If you haven't already, and if you're on Instagram, please follow us on Instagram. It's UWC Sewanee. So that's University Wellness Commons Sewanee. And you'll get a better idea about some of the outreach that you do. And the reason I thought of it when you mentioned the dining hall is because if we can send you this if you can't find it, but if you scroll down a little bit and find something called Sewanee Thrived, we have McClurg Hacks, which is how to make McClurg a gourmet dining experience, according to our students. I don't know. So that particular, it's a spreadsheet that's very popular with our students. So thank you all for coming tonight, and please get in touch with us if you have any questions.
Right. Well, thank you all. I said the date wrong for next week. It's the 25th. Sorry about that. Thanks, Hannah, for letting me know. But anyway, it's great to be with you all tonight, and we'll see you soon. Thank you.
Okay.